From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
Since actress Christina Applegate's breast cancer was discovered on an MRI, that's a magnetic resonance imaging device, a big question for women has been if MRI scans do a better job than mammography at finding disease. Dr. Anu Gupta is with Associates in Radiation Oncology and a frequent guest here on Live This Morning. Good to see you as always, Dr. Gupta. And this is a good question. MRI or mammography, breast x-ray, if you will. It's anecdotally, it sounds like, well, one may be better than the other. What's your feeling?
I don't think one is better than the other. I think for certain patients we know that are at high risk for breast cancer, it's a good complementary tool, but it's not designed, nor is it reasonable to expect it to replace mammography.
And we're talking about the MRI. It is a very expensive scan.
Right.
Mammography has become the gold standard for finding disease. And if anyone's wondering, which should I have, what your doctor has told you, chances are is absolutely the right thing.
So when we talk about which test should you have, first you should have mammography. Every woman should have that starting at the age of 40. American Cancer Society has defined a risk of patients that are at higher risk who would benefit from MRI in addition to mammography. Those are women with strong family histories, genetic predispositions, or greater than a 20% lifetime risk of developing breast cancer.
One of the things to make us lean toward mammography over MRI is MRI has a higher rate of false positives in some studies.
It does, and it can lead to further unnecessary tests such as biopsy. And
I want to bring, I mention that because I want to bring up something that perhaps has a lot of people concerned, or at least questioning the sort of the conventional wisdom. Head of the American Cancer Society in this country wrote a paper, and then it was picked up yesterday in the New York Times, front page of the New York Times, in which he effectively said that in two areas of cancer diagnosis and treatment, we may be doing too much. He specifically mentioned breast cancer and prostate cancer, and we've been talking about this ourselves, that there's more treatment and there is more anxiety for some patients than perhaps they need. What do you think about that?
So I think, talk about use of MRI, it is getting overutilized for the diagnosis of breast cancer, because we do have a defined, clear risk, high risk group of patients that would benefit. It's not meant for everyone, and unfortunately it's getting kind of willy-nilly used on everyone. Prostate cancer, I think we are starting to realize over the past year that the data is mounting dramatically, that we are overtreating some of these patients. So I would agree with him on that.
So what do you do then when, for instance, you're a 60-year-old man and you're diagnosed with prostate cancer? The immediate reaction is, okay, we have to do something about this.
That is the immediate reaction.
What do you say to that patient?
So I think that's where you have to have a very thorough conversation with the patient as to what is his risk of actually dying of prostate cancer, and just get away from the fear of having it. It
always comes down to the communication between the patient and the physician. So often the patient tends to retreat into a shell, and that's exactly the wrong thing to have happen. You really do
need to be informed.
Open those lines of communication. Dr. Anu Gupta, it's always a pleasure.
Thank you
so much for joining us. More information, check out the website, which is raddocs.com.